So let's check out some of the human studies on CoQ-10 and the benefits of supplementation. So in this particular study, you can see here, patients with moderate to severe heart failure were randomly assigned, this was a 2-year prospective trial, to either CoQ-10, 100 milligrams 3 times a day, or placebo. So the dosing in this study was 300 milligrams a day. Now that's important because most of your over-the-counter supplements for CoQ-10 are going to be 20 to 50 milligrams per capsule. And so when you're thinking about, should you take CoQ-10 and how much CoQ-10 you should take, again, this research study is measuring the effect of 300 milligrams of CoQ-10 a day and on heart failure. And so in this study, there were 420 patients, human patients. You see conclusions. Long-term CoQ-10 treatment of patients with chronic heart failure is safe. It improves symptoms and reduces major adverse cardiovascular events. So positive outcomes using CoQ-10 as a treatment agent. I was once invited to a hospital system. This was probably over 15 years ago. And they wanted to do a research study, and what they were asking me to do was to donate my CoQ-10 from my company. And so they wanted to do a study on CoQ-10 and heart failure. And so I got to the table with all these cardiologists, and of course they were sharing the study parameters, and I read the parameters of the research study. And then my first question was, why did you design the study to fail? They had actually, on purpose, created a trial where they were trying to use 50 milligrams of CoQ-10 per day. And of course, 50 milligrams won't do much for congestive heart failure. This particular study was to be done on congestive heart failure. And there was already pretty clear research even back then at the time that you needed at least 200 milligrams of CoQ-10 to have any kind of impact on congestive heart failure. So what these doctors were trying to do was get me to donate my CoQ-10 to a study that was designed on purpose to fail using only 50 milligrams. And so when I asked them, why did you design the study to fail? Why did you come in with such a low dose? They all got really embarrassed because they knew I had caught them in what they were actually trying to do, which was create a research study that showed that CoQ-10 doesn't work. They were trying to show CoQ-10 doesn't work, and they were going to publish this thing and most likely rely on ignorant folks in the media to report that CoQ-10 was ineffective against congestive heart failure without understanding that the dose needs to be at least 200 milligrams a day in order to have any impact or effectiveness. So that's just a little anecdote for you on my experience with this. Now, let's blow this other one up. So this was a research paper done on peripheral nerve injury. And so you can see here studies showed that antioxidants such as CoQ-10, a potent antioxidant, help the regeneration of peripheral nerve injuries. It has been observed to increase the myelinization process in nerve fibers and promote nerve regeneration, in this case, rats. There's a lot of research studies in animal models on peripheral nerve injury. And I have seen this in clinical practice with many, many people where we'll find patients will have either peripheral neuropathy or nerve injury, meaning maybe they had trauma, or they had some type of chemical-induced trauma, and I'll get to that shortly. There are a lot of drugs that cause neuropathy, and that's what we would call chemical-induced trauma. So these individuals, at least in my own experience, are very frequently deficient in CoQ-10 when we test their levels, and they respond typically very, very well to CoQ-10 supplementation. But most of the trials of peripheral nerve regeneration occur in animals. I'm waiting for somebody to put together a nice trial in humans on peripheral nerve injury, but the animal research is very, very clear on that topic. And we've also got, let's blow this one up, we've got research on, this is in humans, so treatment of essential hypertension with coenzyme Q10 or CoQ-10, 109 patients with symptomatic essential hypertension. They were giving, on average, 225 milligrams a day. So again, the dosing, keep in mind, these are not 50 milligram doses. These are 4 times, 5 times, 6 times that 50 milligram mark, and this is per day. So in this case, an average dose of 225 milligrams a day. What they found was a definite and gradual improvement in functional status observed with the concomitant need to gradually decrease antihypertensive drug therapy within the first 1 to 6 months. Thereafter, clinical status and cardiovascular drug requirements stabilized. So over a period of several months, what they found was the need to gradually lower people's blood pressure medications because CoQ-10 was effective at lowering their blood pressure. You can see here 51% of patients came completely off of between 1 and 3 antihypertensive drugs at an average of 4.4 months after starting CoQ-10, this 225 milligrams a day. So takeaway here for you, if you've got high blood pressure and you're going to use CoQ-10 to potentially impact your blood pressure in a positive way, and you're also taking drugs to lower your blood pressure, you need to be upwards of 200 milligrams a day, and it needs to be over long periods of time. You're not going to lower the blood pressure in 1 week. You're not going to lower it in 2 weeks. It took an average of 4.5 months to get these results. So keep that in mind. CoQ-10 is a slow burn. It's not a rapid turnaround when it comes to taking it. Now here's another paper on essential hypertension and CoQ-10. Let's blow this up. 26 patients with essential arterial hypertension were treated with oral CoQ-10, in this case, 50 milligrams twice daily. So this dose was less than half of the other dose. So the other one was 225. This one's 100 milligrams a day. And look what they found in this study. At the end of the treatment, so this is 10 weeks, into the treatment, systolic blood pressure, that's the top number, systolic is the top number when you're taking your blood pressure, decreased from 164.5, okay, to 146.7. So we're talking almost 20 points, about, not exactly, but about 18 points of reduction on the top number. And when we look at the diastolic blood pressure, that's the bottom number, decreased from 98.1 down to 86.1. So that's 12 points. So if systolic was 18, diastolic was 12-point reduction. I mean, that's pretty impressive for a nutrient. That's pretty impressive for something that your body needs anyway, that has virtually a low to no side effect profile and has the potential to help people get off of their blood pressure medications. So number of trials in blood pressure reduction using CoQ-10. Here's another really good one I want to talk about here let's blow this one up. CoQ-10 improves blood pressure and glycemic control. So you can see here, this study performed at University of Western Australia, Department of Medicine. The main effect of CoQ-10 was to significantly decrease systolic and diastolic blood pressure, as well as hemoglobin A1C. So in this trial or in this study, they had both lowering of blood pressure, both numbers, as well as a hemoglobin A1C, which is a marker for average blood sugar over time. These results show that CoQ-10 supplementation may improve blood pressure and long-term glycemic control in subjects with type 2 diabetes. Profound, because how many of your doctors are recommending CoQ-10? Typically the scenario is doctors don't recommend CoQ-10. What they do is they recommend blood pressure drugs and diabetic drugs, which we're going to talk about in just a minute. I'm going to show you how those drugs can actually increase your CoQ-10 deficiency. And this next one is an overview of a number of different research studies. And guys, pay particular attention, ladies too, especially if you're trying to have children and you're struggling at this. What they found with CoQ-10 research studies is, and there's several of them listed here, you can see dosing of CoQ-10, 300 milligrams a day for 26 weeks, improved sperm morphology, density, and motility. So the morphology is the shape. So if sperm is abnormally shaped, it won't swim as well. It won't make the journey quite as well. So CoQ-10 improves sperm shape as well as their speed of swimming, their motility, their ability to swim. In this other study here, 200 milligrams a day. So this was 300. This one was 200 milligrams a day, specifically giving ubiquinol. Ubiquinol is the better form of CoQ-10, and we'll talk about some of that here in just a minute. But improved sperm density, motility, and morphology. So same outcome, same parameters at a lower dose using a different kind of CoQ-10. You can see in this next study, 200 milligrams a day for 6 months, improved sperm parameters. You see down here, CoQ-10, 20 milligrams of CoQ-10 3 times a day, plus 10 milliliters of L-carnitine 3 times a day for 3 months. So this was 60 milligrams of CoQ-10. Predominantly improves semen parameters and improved clinical pregnancy outcomes. And then we have this next study, 200 milligrams of CoQ-10 a day with selenium, improved sperm concentration, motility, improved antioxidant status with CoQ-10 treatment. And this next one, 30 milligrams a day of CoQ-10 plus 300 milligrams of vitamin E for 3 months, improved sperm concentration and motility. And then down here, they gave a multi-nutrient supplement or a multi-component supplement, CoQ-10 being one of the primary ingredients, improved sperm concentration, motility, and improved pregnancy rates. So CoQ-10 is no joke, guys, when it comes to enhancing the quality, the density, the quantity, and the ability of your sperm, their shape, and the ability of them to swim and make the journey. CoQ-10 improves all of those things.